Sciatic nerve pain or sciatica is a very common complaint to any manual therapy clinic. Sciatic pain generally presents as pain in one buttock that refers down the leg. It can either refer down the entire leg all the way into the foot or partway down the leg, generally to about just before the back of the knee. The sciatic nerve starts in the lower back and pelvic area and travels all the way down the leg. Think of it like a railway system. It travels under bridges, over crossings. You get the idea. In order to reduce symptoms related to sciatic nerve pain or irritation, we try to actually target the pathway of the sciatic nerve. So that means we're not just going to target the origin of the sciatic nerve in the lower back or pelvis. We're actually going to try and target the pathway of the sciatic nerve as it passes through the entire leg. This means we want to target the lower back, pelvis, hamstring, calf, and foot. We can do this by means of improving flexibility and also mobility. Today we're going to go through some simple techniques that you can do yourself at home that can help reduce the symptoms related to potential sciatic nerve irritation. Of course, it's advised that if any of these techniques produce sharp or shooting pain, please stop and seek advice from a healthcare practitioner. Lying on your back, aim to imprint your spine onto the floor, then arch it up off the floor. Work in between these two extremes. This will help to mobilize the lower spine. To release off the fleshy part of the glutes, you can use the foam roller or trigger ball as seen. Same thing, make sure you stick to the sore spots until you feel at ease. On a hard surface, such as a kitchen stool or table, sit up tall on your sit bones. Place the ball under the furthest part of your hamstring, just above behind the knee. Aim to bring your toes to your nose as you then extend at the knee. Press the thigh down into the ball. This will help to release off the hamstring muscle. Continue to move the ball up further towards your sit bone in order to target all aspects of the hamstring. One thing to watch out for is that you don't round the lower spine as you extend at the knee. This will ensure tension stays on the nervous system. Make sure you sit right up on your sit bones. To release off the calf muscles, use a foam roller or a trigger ball. Start the ball or roller under your Achilles. Use the opposite leg to put pressure down on the leg that you are releasing. Roll it from side to side. Move the roller or ball up all the way towards the back of the knee. This can often be an awkward one for a lot of people because they lift their bum up off the floor. Keep it planted and take control over the roller. To release off the feet or the plantar fascia, take the ball under the ball of the foot and slowly roll it towards the front of the heel. You can do this in the kneeling position as shown or in a standing position. Put your body weight over the foot and over the ball. Make sure you work through the entire sole of the foot. Neural flossing is a technique used for any nerve where we actually floss the nerve along its pathway through the body. For the sciatic nerve, simply grab a towel or a yoga strap and place it around the ball of the foot. As you extend the leg, aim to get your toes to your nose and the back of the knee to the back wall. The aim of this stretch isn't to necessarily get your foot to your ear, but to essentially bend and straighten the leg so that you are continuously putting the sciatic nerve on tension and off tension. To enhance the stretch, put your head on the edge of a pillow so that your head is sitting in flexion. This will add extra tension to the neural system and enhance the neural stretch behind the back of the leg. Do this only for a couple of minutes, a couple times a day. You don't want to irritate the nerve too much. Perform these exercises and movements a few times a day, maybe 2 or 3 times a day if that suits you. You don't want to do them too much because sometimes you can actually irritate the sciatic nerve further. If symptoms do persist, please do take the time to go and see a healthcare professional, and they can further guide you and give you specific advice related to your specific presentation. I hope this helps.